Welcome to practice test 4 of our Fundamentals of Nursing MCQs series. Today we will go through 50 essential questions that will test your knowledge in fluids and electrolytes, base acid-base balance, lab value, nutrition, IV therapy, and blood product. These questions will help you in your preparation for the upcoming NCLEX, OSCE, RN, BSc, MSc, or any other nursing licensing exam. So what I will do, I will read the question and you will read the option. Then you can pause the video for 3 to 5 seconds and then I will share the correct answer with you. So you can compare your selection with the correct answer which I will provide to you. In this way, you will remember the question. Let's begin. Question number 1. Which electrolyte is a key for heart and muscle function? Read the 4 option and then pause the video for 3 to 5 seconds. Then I will give you the correct answer. In this scenario, the correct answer is option B, potassium. Let's move to the next question. Question number 2. The patient has weakness and irregular heartbeat, most likely imbalance. Or option, and then I will share the correct answer with you. In this scenario, the correct answer is option B, hypokalemia. Let's move to question number 3. pH of 7.25, PaCO2 equal to 5 millimeter of mercury, bicarb is 24 milliequivalent per liter. Indicate and read the option. Is it indicate respiratory acidosis, metabolic acidosis, respiratory alkalosis, or metabolic alkalosis? In this scenario, the correct answer is option A, respiratory acidosis. When the pH is 7.2, PCO2 is 55 millimeter of mercury and bicarb is 22. So it's indicate respiratory acidosis. Let's move to question number 4. Serum sodium level of 130 milliequivalent per liter indicates. Read the 4 option and then I'm going to give you the correct answer. In this scenario, the correct answer is option B, hyponatremia, because the sodium level is less than 135 to 145 is the normal value. So if it is less than 135, it's mean that patient is in hyponatremia. Let's move to the next question. Number 4. Which nutrient is most important for bone healing? Read the 4 option. Then I will share the correct answer with you. These questions are related to fluids and electrolyte, acid-base and acid-base balance, that value, nutrition, IV therapy, and blood product. Correct is option B, which is protein. Protein is the essential nutrients which help in wound healing. Number 6 is during pregnancy, which nutrients requirement increase mostly? 4 options. Then I will give the answer. During pregnancy, which nutrient requirement increase? The correct answer is option A, iron. During pregnancy, the iron requirements increase. Question number 7. Which IV fluid is isotonic and used for resuscitation? Read the 4 option and then I am going to give you the correct answer. In this scenario, the correct answer is option A, 0.9% normal saline. Normal saline is isotonic solution, IV fluid, which is used for resuscitation. Let's move to the next question. Question number 8. Before a blood transfusion, the nurse should first. What the nurse will do? Please read the 4 options. Select your best of choice, and then I will reveal the correct answer with you. In this scenario, the correct answer is option A, check the blood pressure. Before blood transfusion, the nurse will check the blood pressure. The nurse will check the blood type and cross match. Let's move to question number 9. Which lab value may indicate dehydration? Read carefully each 4 options, select your best choice, and then I will give you the correct answer. Please don't forget to like and subscribe our YouTube channel if you think that these questions are helpful for you and these questions increase your knowledge in learning. In this way, you will get the notification once we upload our next practice test, which is practice test 5, fundamental of nursing. The correct answer is option B, elevated hematocrit. Elevated hematocrit indicates dehydration. Let's move to question number 10. Question number 10 is, a patient receiving IV potassium should be monitored for. When someone is receiving IV potassium, so what the nurse will monitor, which electrolyte the nurse will monitor? In this scenario, the correct option is option B, hyperkalemia. So if someone is receiving IV potassium, the nurse will monitor for hyperkalemia. Let's move to question number 11. Before I read this question, I would like to request everyone to share their score in the comment section so I can know how many questions you get corrected and out of 10. Question number 11. Which acid-base imbalance occurs with vomiting? Very important question. Read the 4 options. Select your best choice, and then I will reveal the correct answer with you. I will give you the correct answer, and then we can read together. So in this way, it will increase your knowledge, and you will remember the scenario in a proper way. In this scenario, the correct option is option B, metabolic alkalosis. Question number 12. Hypocalcemia can cause. What hypocalcemia can cause? Read the 4 options. After that, I will give you the correct answer. In this scenario, the correct answer is option A. Option A is tetany. So hypocalcemia causes tetany. Let's move to the next question. Question number 13. Normal serum potassium range is. Read the 4 options. Pause the video for 3 to 5 seconds and select your best option. In this scenario, the correct option is option B. The normal value of potassium is 3.5 to 5.0. Let's move to the next question. Question number 14. Which IV solution is hypertonic? Read the 4 options. In this scenario, the correct answer is option C. 3% saline is hypertonic solution. Question number 15. Which lab indicates renal function? Read the 4 options, pause the video for 3 to 5 seconds, and then I will give you the correct answer. I would request everyone to like and subscribe our YouTube channel so you will get the notification once we upload our next question practice test 5, which is fundamental of nursing practice test 5. In this scenario the correct answer is BUN, blood urea nitrogen. This is the lab value which indicate the renal function. Let's move to question number 16. Which is the main function of albumin? There are four options. You can read the question, the option, and then I will share the correct answer with you. The main function of albumin, always lock the keyword and then go to the option, read carefully, use your practical and theoretical knowledge. In this scenario, the correct answer is option B, fluid balance. Let's move to the next question. The next question is question number 17. Which vitamin is essential for calcium absorption? Pause the video for 3 to 5 seconds. In this scenario, the correct option is option D. Vitamin D is essential for calcium absorption. Question number 18. A patient with a pH of 7.30 bicarb 18 has which condition it suggests if the value is like 7.3 pH and bicarb 18? The correct answer in this scenario is option B, metabolic acidosis. Let's move to another question. Question number 19. Which electrolyte imbalance cause peaked T waves? And you check the ECG. In ECG, the T wave is stall or peaked. So what it suggests? So what electrolyte imbalance it will suggest? In this scenario, the correct answer is option B, hyperkalemia. So stalled T wave in ECG, it will suggest hyperkalemia. Let's move to question number 20. Which nutrient is needed for red blood cell production? Four options. I will share the correct answer with you. Once you finalize your correct option, in this scenario, the correct answer is option B, which is protein. Protein is needed for the red blood cell production. Question number 21. The main carbohydrate storage in the body is in the form of fat, glycogen, protein. In this way, you can read the four options. Which is the best one, you think? In this scenario, the correct option is option B. Glycogen is the main carbohydrate storage in the body. Let's move to question number 22. The recommended daily protein intake for adult is approximately the correct option. Select the best option. In this scenario, the correct answer is option A. 0.8 gram per kg is the recommended daily protein intake for the adult daily. Question number 23. Which IV line is preferred for short-term therapy? Read the four options. Select the best choice. Pause the video for 3 to 5 seconds. In this scenario, the correct answer is option A, peripheral line. Peripheral line is preferred for short-term therapy. Question number 24. Which complication is common with IV therapy? Read the four options. In this scenario, the correct option is option A, phlebitis. Phlebitis is a common complication with IV therapy. Question number 25. A blood transfusion reaction includes which of these indicate blood transfusion reaction? The correct answer is option A. Fever and chills indicate blood transfusion reaction. Question number 26. Which fluid compartment contains most of the body water? Read the four options. Pause the video for 3 to 5 seconds. In this scenario, the correct answer is option A, intracellular. Intracellular compartment contain the most fluid of the body. Question number 27. Normal serum sodium range is. Read the four options. What is the normal serum sodium level or range? In this scenario, the correct answer is option B, 135 to 145 milliequivalent per liter. Let's move to question number 28. Please share your score in the comment section, how you are performing in this section of in this practice test of nursing fundamental MCQs, which is our series of the practice test. And this test is related to fluids and electrolyte, acid-base balance, lab value, nutrition, IV therapy, and blood product. So our aim is to give you knowledge. In this way, you will prepare yourself for upcoming NCLEX, OSCE, RN, BSc, MSc, or any other nursing licensing exam or any other board exam. Then question number 28 is hypomagnesemia may cause. What hypomagnesemia is causing? The correct answer is option A, tremor. When the magnesium level is low, so it causes tremor. Let's move to question number 29. Which lab value reflect long-term glucose control? Read the four options and then I will give you the correct answer. In this scenario, the correct answer is option B, hemoglobin HbA1c, which reflect the long-term glucose control. Let's move to question number 30. The recommended weight gain in pregnancy for a normal BMI is. What is the recommended weight gain? Read the four options, select your best option choice, and then I'm going to give you the correct answer. Compare your option with the correct one, which is option B, 11 to 16 kg. Weight gain is recommended in pregnancy for a normal BMI. Question number 31. Iron supplementation in pregnancy help prevents. What iron do in pregnancy? Which condition it's prevent from? The correct answer is option B, anemia. In pregnancy, iron supplementation helps in prevention of anemia. Let's move to the next question. Question number 32. Which electrolyte is essential for muscle contraction? Read the four options. Pause the video for 3 to 5 seconds. In this scenario, the correct answer is option C, calcium. Calcium is the electrolyte which is essential for muscle contraction. Let's move to question number 33. A patient with a pH of 7.50 bicarb, PCO2 is 30 millimeter of mercury. So what does this indicate? This I would love, like if you people will share the answer part this question especially, because always I get comments that this is the tough question, and if anyone is able to correct the answer, so that will be excellent. So please share in the comment section that was you able to answer this question or no. If no, so go in read about the pH bicarb PCO2 and then understand what does it indicate, if the pH is increasing, decreasing, bicarb increase, decrease. So this is just like a little calculation you need to do. In this situation, the correct answer is option A, respiratory alkalosis. Let's move to the next question, question number 34. Hypovolemia cause. What hypovolemia cause? If the volume is low, hypovolemia. Low volume cause. What does it cause? The correct answer is low blood pressure. Okay, this is the correct answer. Let's move to question number 35. Which IV fluid correct both dehydration and sodium loss? Read the four options, select your best choice, and then reveal it with the correct answer which I will provide to you. In this scenario, the correct answer is option A. Normal saline is the IV fluid which correct both dehydration and sodium loss. Let's move to question number 36. Which vitamin K is essential for? Read the four options, which is the best choice. Pause the video for 3 to 5 seconds. In this scenario, the correct answer is blood clotting. Vitamin K is essential for blood clotting. Let's move to question number 37. Which complication is monitored after blood transfusion? Read the four options. Hemolytic reaction, hypothermia, constipation, and muscle cramps. Which one is the correct option? In this scenario, the correct option is hemolytic reaction. Hemolytic reaction is monitored after blood transfusion. So again, I would request everyone to like and subscribe our YouTube channel, because soon we will upload the next practice test, which is practice test 5, fundamental of nursing. So you will get the notification if you will subscribe to our YouTube channel. In this way, you will get knowledge, and that knowledge will help you in your exam preparation. Either you are preparing for NCLEX exam, OSCE exam, RN, BSc, MSc, or nursing license exam, any other nursing license exam. So definitely these questions will help you for your preparation of these exams. Let's move to the question number 38. The main purpose of IV therapy is. Read the four options. What is the main function of IV therapy? Is it provide hydration in meds, improve digestion, increase muscle mass, decrease metabolism? The correct option is option A. Provide provide hydration in meds. So IV therapy provide hydration in meds. Question number 39. Hypokalemia ECG shows. What the ECG shows when there is, the potassium level is low. Read the four options. Pause the video for 3 to 5 seconds. Select your best choice and then reveal it to our correct option in this. Correct answer is option A. Latent fever. Hypokalemia and ECG show latent fever. Question 40. Which fluid is preferred for maintenance therapy? Four kind of fluids you already know. Some of them are isotonic, hypotonic, or this practice. Now you decide about this one. Which fluid is preferred for maintenance therapy? In this scenario, the correct answer is saline, which is option saline is preferred maintenance therapy. Let's move to question number 41. IBUN nitrogen may indicate if the blood urea nitrogen level is high in the blood. So what does it indicate? The correct option is kidney dysfunction. IBUN blood urea nitrogen indicates kidney dysfunction. Let's move to question number 42. Patient with metabolic acidosis may have which kind of respiration the patient will have, which kind of respiration usually the patient have when the patient is in metabolic acidosis. In this scenario, the correct option is option A, cosomal respiration the patient will have when the patient is in metabolic acidosis. Let's move to question number 43. Which nutrient is essential for fetal neural development? Read the four options, pause the video for 3 to 5 seconds and select your best choice. So in this scenario, the correct answer is option B. Folic acid is the nutrient which is essential for fetal neural development. Let's move to question number 44. Which IV complication is infiltration? Read the four options and then select your best choice. Then we will provide you the correct answer. Reveal your option with the correct answer which we will provide to you. Please do not forget to watch the practice test 1 of fundamental of nursing, practice test 2 of fundamental of nursing, and practice test 3 of our fundamental of nursing series MCQs. If you didn't watch, I would strongly recommend to watch them and get your knowledge. And if I will share the link in the description for all these 3 videos, so you will able to watch them. In this way you will get your knowledge. So in this situation, the correct option is fluid enters tissue. Let's move to question number 45. Blood transfusion are usually administered through which line is used for blood transfusion? Read the four options. Always go for the basic knowledge. Don't think. Do not overthinking. Select the first option. In this scenario, the best option is peripheral line is used for the blood transfusion administration. Let's move to question number 46. Hypernatremia may cause. What hypernatremia cause? In this scenario is the correct option is option D. It causes confusion, lethargy, and seizure. So these are some of the causes of hypernatremia. Let's move to question number 47. Which lab value reflect liver function? Read the four options. Pause the video for 3 to 5 seconds. In this scenario, the correct option is option A, AST. AST is the lab value which reflect on the liver function. Let's move to question number 48. Hypocalcemia can result in. Read the four option, pause the video for 3 to 5 seconds, select your best choice and then reveal the best choice with the correct answer which we will provide to you. The scenario, I'm sure that you will be able to answer this question. The correct answer is option A, tetany. Hypocalcemia can cause tetany. Let's move to question number 49. Which IV therapy is used for blood transfusion? Read the four options carefully. As you know that this practice test focus mainly on fluids in electrolyte, acid-base balance, lab value, nutrition, IV therapy, and blood products. And regularly you are getting the question relating to these topics. In the aim of these questions that you will able to prepare yourself for the NCLEX, OSCE, RN, BSc, MSc, nursing licensing exam or any other board exam. So in this scenario, the correct answer is normal saline 0.9% is used for blood transfusion therapy. Let's move to the last question of this practice test, which is a patient on IV potassium should be monitored for. What the nurse will monitor if the patient is receiving IV potassium. Read the four options, pause the video for 3 to 5 seconds, and also share your score in the comment section so I can see that how everyone is performing, and also share your opinion about these questions. Is this question these questions are helpful for you, and which type of exam you are preparing, so that will increase a little interest. And if you needs any opinion, any comments you have, any inquiries you have, you can leave in the comment section and we will respond to you. So in this scenario, the correct option is option A. I will go to you with this here. Option A is arrhythmia. So the nurse will monitor for arrhythmia if a patient is on IV potassium. So that's all. 50 question was there in this video, in this practice test. I hope this question will be helpful for your upcoming NCLEX RN exam or NCLEX PN exam, any other nursing licensing exam. So in the focus of this question was on nutrition, fluids and electrolytes, nutrition, IV therapy, lab value and blood products. Thank you so much for watching this video, and good luck for your upcoming nursing licensing exam. The last and final tip is practice makes perfect. So as much as you practice, you will get knowledge, and that knowledge will help you in your preparation, and that will help you to pass your licensing exam. Thank you so much and have a nice day, and don't forget to watch the upcoming video. We will just like and subscribe our channel. You will get the notification once we upload our next question, practice test 5, fundamental of nursing. Thank you so much, and thank you so much for watching. Have a nice day.